Lesbian, Gay, Bisexual, and Transgender Pride Month, LGBT Pride Month, and honor the 1969 Stonewall riots in Manhattan. As many of you know, the Stonewall riots were a tipping point for the gay liberation movement in the U.S. June, therefore, represents an ideal time to particularly note our community's ongoing successes and opportunities. Today's webinar is sponsored by the Building the Next Generation of Academic Physicians, with support by the NIH Sexual and Gender Minority Research Office. Just to give you a little bit of background, BNGAP was developed to help diverse graduate students, such as LGBTQA identified trainees, become aware of academic careers and to provide them with the resources to further explore and potentially embark on an academic career. Building our LGBT research workforce is critical to better understanding and addressing unique health issues and disparities for LGBT individuals. Today's webinar is a follow-up to another activity that was conducted between BNGAP and the NIH Sexual and Gender Minority Research Office. On May 4th, both groups offered a grant writing seminar at the 6th Annual LGBT Health Workforce Conference. At that grant writing seminar, there were sessions such as how funding agencies work, essential elements of a successful research protocol, one-on-one specific aims review with senior researchers, a mock NIH study section, and a session on post-submission, score, summary statement, and grant resubmission. The next conference, the 7th Annual LGBT Health Workforce Conference, will be occurring on May 3rd and 4th. Today's webinar has three primary learning objectives: to review the mission and strategic goals of the NIH Sexual and Gender Minority Research Office, to describe SGMRO 2017-2018 accomplishments and goals activities for the 2018-2019 academic year, and to list research training opportunities at NIH inclusive of SGM Health Research. Today, I'm joined by Dr. Karen Parker, who serves as the inaugural director of the Sexual and Gender Minority Research Office, which is located or situated within the Division of Program Coordination, Planning, and Strategic Initiatives of the Office of the Director of the NIH. Our second speaker will be Dr. Susanna Allison, who is Program Officer for the Division of AIDS Research at the National Institute of Mental Health at NIH. Thank you once again for joining the webinar, and now I'll be turning it over to Dr. Karen Parker.
Great, thank you so much, JP. As JP said, my name is Karen Parker. My pronouns are she and her, and I'm the director of the Sexual and Gender Minority Research Office at NIH, which was established in 2015. So today I'm going to just give a quick background about how our office became established. I'm going to talk a little bit about our strategic plan. I'm going to talk about the 21st Century Cures Act and how it impacts our work here at the agency. And then I'm also going to talk about FY 2018 planned initiatives, where we are sort of right in the middle of conducting a lot of those initiatives. So in terms of background, many of you have probably heard about the IOM report that came out in 2011. That was commissioned by NIH in 2009. And the interesting thing about NIH at that time was that 19 of the 27 components at NIH provided either financial or in-kind support for this publication. And so even in 2009, I think that there was a pretty broad understanding that NIH knew that there were a lot of unanswered questions and that we needed to think about where to go in terms of SGM health research. So this report really was a response to this call from the research community and included an extensive literature review, and it really was the first ever comprehensive report on LGBT health. So as a result of that, the NIH established what was then called the NIH LGBT Coordinating Committee, and its charge was for 1 year to take a look at what NIH was actually funding and research on LGBT health. And so people from across the agency, from all the 27 different institutes and centers, came together to look at what it was that we were funding. And when we presented that report to the director of NIH, Dr. Collins, he basically said, we're not doing enough. So he recommissioned that committee to be a long-standing committee to really look at how is NIH doing in this space and how can we do more. And so that committee is now called the SGM Research Coordinating Committee, and to this day is incredibly active. I think it's one of the most productive committees at NIH, and people on this committee are incredibly, really just absolutely committed to this work. And so one of the things that the committee did prior to the office being established was to develop a sexual and gender minority research strategic plan. And this plan really guides all of the work that our office does. And we really think about communicating and encouraging parts of the agency to do work in sexual and gender minority health research. And so the plan is really an agency plan, and it's not just for our office. So we think about how we track it and we report out on it, but this really is something that the entire NIH is committed to. So goal 1 of the strategic plan is to expand the knowledge base. So this really is just about increasing research in this area, and that's kind of NIH's bread and butter, so that makes sense. We have seen steady increases in SGM funding over the past several years, and we have seen an increase in program announcements that have included interest within sexual and gender minority health research. And Susanna will talk a little bit more about funding opportunities when she talks. And so I do think one of the things to remember, though, as we think about how we can do this, there's lots of things that NIH can do to expand research and interest in this area, but we can't fund what we don't receive. So if we're not receiving applications that are related to SGM health research, we can't fund them. And so that's just something to keep in mind as you think about where the research portfolio at NIH is going. So goal 2 is to remove barriers to planning, conducting, and reporting NIH-supported research. And so this goal is really the reason that the office exists. So objective 1 under goal 2 was to establish the Sexual and Gender Minority Research Office within the Office of the Director. And we sit within the Office of the Director so that we have a bird's eye view of the entire agency, and we can really help folks across the board think about the mission of their institute or center and how it intersects with SGM Health. So goal 3 is to strengthen the community of researchers and scholars who conduct research relevant to SGM health and well-being. And we really think about this in a two-pronged way. So we're really interested in supporting scholars who are doing SGM-related research. And then we're also interested in supporting SGM-identified researchers who are doing scientific work across the board. And we often get asked about the difference between minority health and health disparity status. So many of you might know that in 2016, the National Institute for Minority and Health Disparities Director announced that sexual and gender minority populations would now be considered a health disparity population for research at NIH. And that has made really big impacts across the board in terms of research. What that didn't do was establish sexual and gender minority populations as a disparity group. And so people often ask me about, for example, diversity supplements that folks in other minority communities can apply for. So sexual and gender minority identification does not actually make one eligible for those. And the reason is that we don't actually have the data to demonstrate that sexual and gender minority populations are an underrepresented population within the biomedical workforce. And so that's a conversation that we're having in NIH about how can we actually get that data. So goal 4 of the strategic plan is to evaluate progress on advancing SGM research, and we do that in a variety of ways. The main way that we do that is through our reporting, and so this just gives you a sense of the past 4 major reports that our office has put out over the past 2 years. So each year we put out a portfolio analysis, and that portfolio analysis really highlights how many grants we're actually funding and how much money we're spending. And then each year there's sort of a companion document that's 1 fiscal year off, that's our annual report. And that really highlights all of the research-related activities that are happening here at NIH that aren't the actual grants. So the portfolio analysis is really about counting grants and looking at where they fit across the institutes and centers. And the annual report is really about all of the other work that's happening here in support of SGM health research. The report that's on the far right is our FY 2017 annual report, and we just released that this past Monday. So our website has all 4 of these reports available for download. So now I'm going to quickly talk about the 21st Century Cures Act. So this was signed into law by President Barack Obama on December 13th of 2016. It had really broad bipartisan support, so which is incredibly helpful, and it made provisions primarily focused on the Food and Drug Administration and NIH. And tucked within that legislation was an SGM-specific provision. And so because of that, the Public Health Service Act basically now reads that the director of NIH shall encourage efforts to improve research related to the health of sexual and gender minority populations. And so this has been really helpful as we have thought about ways that we can move research forward and the way that we can move our activities forward, because we're really supposed to be thinking about things like increased participation of SGM populations in clinical research, facilitating the development of valid and reliable methods and measures, and then also really thinking about methodological challenges within this research space. So in terms of our FY18 planned initiatives, so on April 3rd and 4th, we held a methods and measurement workshop where we brought together experts from across the country to really say, where are some of the key research questions in measurement and methods of sexual and gender minority populations? And so as a result of that workshop, we're working on a summary of that. We will most likely put out a request for information. So we'll post a document, we'll get folks feedback to say, are there key research questions that we're missing? Are there other things we should be considering? And are these research questions important to the community? And so that's something that we hope to be doing by the end of this calendar year, is putting out the RFI. We are thinking about ways to develop a points to consider in SGM research document, or possibly some other sort of resource that people could use, particularly program officers at NIH who aren't necessarily familiar with this work, but who may be getting some applications in and they're talking to principal investigators. We also think some information might be helpful for the Center for Scientific Review in terms of how they review grants. So we do have representation from CSR on the SGM Research Coordinating Committee. And so we certainly are thinking about ways that we can work with CSR to make sure that all of the SGM-related applications at NIH are getting fair review. And so that's something that we're thinking about. I imagine that resource will most likely be completed in FY19. We held a regional SGM research seminar in conjunction with Fenway Health, where several program officers from across NIH traveled to Boston, and we really focused on students, postdocs, and early investigators so that we could kind of lift the veil off of NIH, talk to people about funding mechanisms, about reaching out to program officers, and about really the grant personship process. And so that was the first in what we hope will be a series. We will most likely be doing another one of those at the University of California, Los Angeles, and then also a follow-up next spring at Emory University in Atlanta. And then from there, we will move to some other regions of the country. So be on the lookout for that. One thing that we start sort of just getting ready to announce is our investigator awards in SGM Health Research. So we put out a call for nominations for people who are doing outstanding research in SGM Health, and those are currently under review. And once we award 2 of these, we will invite these folks to come to NIH and to do a presentation that will most likely be videocast, so that everybody can see the amazing work that these folks are doing who are early investigators. And then finally, we're looking at review of our NIH SGM Research Strategic Plan. So we have a sexual and gender minority research working group, which is several experts from the extramural community, so not at NIH, who come at least once a year to advise the Sexual and Gender Minority Research Office on our activities. And so in September, they will be reviewing the reports that we've put out and additional data so that they can then say, this is where NIH has made great progress, and this is where we think NIH could make a few course corrections to make a larger impact within the field. And so we're looking forward to getting that review. That review will certainly inform the office as we move forward with another strategic plan. So we will be beginning next year to start thinking about the strategic plan that'll be from 2021 to 2016. One thing I'd like to say is we do have an SGM listserv. If you're not a part of it, I suggest that you join. If you Google SGMRO, the office is the first website that comes up. And if you click on Get Connected, there's a way to join our listserv. It's very easy. I don't send out a lot of emails, but I do promote things like requests for information from the government that are relevant, information about signing up for regional workshops, those types of things. And so I encourage you to join. And then that's really all I have. I believe we're going to hold questions until the end, but I'm happy to talk more. And I look forward to Susanna's presentation that's a little more focused on grantspersonship.
The take-home of this slide, besides just having some random knowledge around the fact that there's 27 institutes and centers at NIH, so if you're ever on Jeopardy, you'd be able to answer that question. But really the take-home is that there are many different places where your research might be a good fit. So just because you go to one institute and are told that it's what you're proposing is not a high priority, be sure that you're asking about potentially other places and doing some exploring and research to see what some of the other institutes and centers are funding, because oftentimes there are multiple homes for different grant applications. So just in case you need to sign off, I'm going to give you my 3 big takeaway points for this talk. The first one is to reach out to a program officer at NIH before you apply. So the worst situation for me, anyway, is to get a grant application that I know someone's worked really hard on and for a long time, and just notice a number of things that I could have advised them against that would help to make that grant more competitive. And we'll talk about what some of those things are. But or it comes in response to a program announcement at NIMH, but it's really not a high priority for NIMH and should go to another institute. So reach out. We're not scary people. We're just like you. And that's part of our job, is to help folks who are looking to submit. The second takeaway is to really find a scientific mentor, and doesn't have to be one. It could be multiple. To be able to, help you with your research and also help you with navigating the NIH system, because it's not always the most user-friendly. So that's why I put in a little caveat there that it is helpful to have a mentor that has had some experience with NIH funding. And then the last takeaway is to really get input from your peers before you submit. And I think this is really helpful for peers who are content experts, who have content expertise. But it can also be helpful to get input from someone else, because sometimes we get so focused and so into our own topic area that we don't explain things that are needed because we're so involved that we don't see those gaps. So sometimes having someone slightly outside of your area of expertise review a concept or outline of your grant can be really helpful in identifying those gaps. So this slide is really highlighting that when you submit a grant application to NIH, you're assigned three different people. There's the program staff, so that's what I am, and I'm going to be telling you a little bit more about how program can help you. You're also assigned to someone at the Center for Scientific Review, typically, who oversees the review of your grant application, and so they can answer questions about the review process for you. And then you're also assigned a grants management person, who is the person who will be looking really closely at your budget when your grant is moving forward for funding. So it's just nice to know that there are these, there's sort of a team that's assigned to your grant and that are there to help you. So what can a program officer help you with? I think I touched on this before, but a program officer can review your research concept to help you determine where, what would be the best institute or center for you, to specify in your application, like where you want it to be assigned. And you can have it request that your application be assigned to more than one institute, which is in your benefit. So a program can help you determine that. They can help you determine which mechanism to apply for, and we're going to be talking a little bit more about mechanisms, and which funding opportunity announcement to respond to, and then which study section it would be not good to request. And the nice thing is you can look up the study sections online, you can see who's on those study sections, so you can get a sense as to what group might have the best expertise for your grant application. So this is a tentative timeline for submitting a grant application. And I think, again, the take-home of this slide is really that it takes quite a long time to pull together a successful grant application. I sometimes get someone calling me like 2 months before a deadline, and they're still working on their specific aims. And that always makes me a little worried because, it is a very competitive process, and you don't want to shoot yourself in the foot by not giving yourself the time and opportunity to get feedback before submitting a grant application. So now I'm going to touch on some of the different funding mechanisms, and I'm going to start with some of the career development awards. So just as an overview, career development awards are ways to support folks throughout their career development. So there are potential awards for folks who are in graduate school, in postdocs, and then early career awards. Now, the mechanisms that I talk about, it's really important that you recognize that not all of those 27 institutes and centers that were on that second slide support every single mechanism. So you really want to make sure that if you're interested in, say, cancer outcomes among transgender men, that you're thinking about applying for a K, that you make sure that the National Cancer Institute is listed on that program announcement for that specific K. And some of these are just are just reiterating some of the points I've already made, so I won't spend too much time on that. So this is, I like this slide because it lays out some of the different mechanisms that are available throughout someone's potential career path. So it starts with, graduate clinical training, moves to postdoc, early career, and then established investigators. And we're going to dive more into this earlier stage in career development with the clinical training, the T32, T35s, and Fs. So there are these NRSA awards that really the goal is to help train folks in biomedical, behavioral, and clinical research. So there's two sort of types of awards, and one are awards that go to institutions. So those are T32s and T35s. And as a trainee, you wouldn't apply to the NIH for a T32. what you would do is you want to find out what institutions have these awards and look into their application process. So as a trainee, you would apply to that institution to get a spot in their training program. And they're usually by topic area. And there is at least one T32 that is focused on SGM health that I'm aware of. And then there are the individual fellowships. So these are ones that you would apply for. And there's the F, so these are the F series, so they're the fellowships. And there's 3 different numbers depending on where you are in your program. So F, like if you're currently a doctoral student, then you would apply for an F31. If you've completed your graduate school training and you're in a postdoctoral position, then an F32 would be the most appropriate. So now that we've talked a little bit about graduate and just early postdoc opportunities, I thought I'd touch on some of the Ks that are also available at NIH. So Ks are also career, they're mentored career awards. So as you can see, all of these have a mentored component. So these awards provide you with additional protected time as an early career investigator to be able to get additional training. So you can take courses, you can travel to meetings, have sort of one-on-one mentoring with folks. You provide a list of the people who are going to be mentoring you, and then you also describe your training goals and then your research goals for the period of time, for your however long you're requesting the award for. And the different Ks correspond to whether or not like a K01 is more for someone who has had a very strong research career already, a strong research graduate program, whereas like a K23 would be for someone who has also been receiving clinical training and is interested in more patient-oriented research. There are also the K99 ROO or the Kangaroo grants. Now these support someone for up to 2 years of a postdoc. And then when you transition to a tenured position, then you would get the ROO phase, which is similar to sort of a small RO1. So it allows you to sort of maybe do some formative work in the postdoc phase, and then once you're at a tenured position as a new faculty, it gives you funds to do, expand that research and do it on a larger scale. Another opportunity for NIH to receive NIH funding are through diversity supplements. And Karen touched on these already. As she mentioned, since we don't have data that SGM researchers are underrepresented, these are not eligible to individuals based on their own SGM status. But if you're from a racial or ethnic a background that's underrepresented in the biomedical sciences, then you could be eligible to apply for an administrative diversity supplement on an existing actively funded research grant. So if you know someone at your institution or at a nearby institution who has NIH funding, and you meet this the eligibility requirements, then you could approach that person and ask if they would be, willing to submit for additional funding to support you on that grant. And what you would do is you would propose to do some work within the scope of the parent grant, and that would help you to move you along in your career development. So NIH has done a nice job, I think, of updating the research training website. So I just wanted to include a snapshot of that so that you can visit to learn more about particular mechanisms. Now I'm just going to touch on some of the research grants. So the ones that I was talking about previously, those were all focused on awards that are designed for you to do research, but also for you to advance your career and take you to the next stage. The research grants are just focused on the research. So the assumption is that you're coming in with the expertise already to do the work, whereas in the training grants, part of the experience is helping you to gain that experience. So the smallest grant is an R03. It's a 1 to 2 years, and it's up to $50,000 in direct costs per year. We don't fund a lot of R03s because $50,000 kind of in this day and age doesn't go very far, and I would never say that in my personal life. Probably the most I clicked before I meant to. Probably the most common R03 is a grant that's looking at doing secondary data analyses or combining two data sets to be able to look at a unique questions that can't be answered with only one data set. And it's great because there's such a push now to really have NIH researchers and others share their data, that there are so many opportunities out there to ask for request data to be able to do your own analyses. So this is really a nice way to be able to take advantage of the publicly accessible data and get some money to fund your time and maybe a statistician's time. Then there's a 2-year R21, and you can see there it's up to $275,000 over 2 years. And the goal of an R21 is really supposed to be around innovation. So it's kind of like a high risk, high reward type of study question. So maybe you're trying to determine if a particular recruitment strategy that's to reach individuals who have been challenging to recruit in the past, and you want to try something new, and you're just not really sure if this is going to work or not. But an R21 is a nice mechanism to try that out. If you're at an institution that does not receive a lot of NIH funding, you may be eligible to apply for an area grant or an R15. So these are for U.S. domestic institutions, up to 3 years, $300,000. And you do have to be on the list of institutions that are eligible. But it is a nice way to be able to collect, to conduct some great science. And then I think the R01 is probably the most well-known, given that it's the largest R grant, and it's up to 5 years, up to $500,000 in direct costs per year. You do need preliminary data to apply for an R01. So if you want to look at the efficacy of a particular intervention, say you're interested in I'm just going to use an example from my portfolio. Like if you're interested in looking at a mobile app and how well it does in linking and retaining youth in HIV care, you would only apply for an R01 if you had developed that app, if you'd already conducted some pilot work, had some feasibility and acceptability data. So it's really quite a high bar in terms of how much data you need coming in to be successful at an R01. So I wanted to touch on the definition of an early stage investigator because there has been, there's always been a push for the NIH to fund more and more early stage investigators. And there have been efforts in sort of, that effort has been reinvigorated over the past year. So you're an early stage investigator if you're within 10 years of completing your terminal degree and you have not been the PI on an R01 or equivalent to an R01. And there are some benefits that you get as an ESI. Sometimes depending on the institute, the pay line can be a little bit higher for ESIs. You're also available. It's also you're eligible for the shortened review cycle if you're applying for non-HIV funding. So this slide summarizes some of the common problems in NIH applications. In particular, for when I think of Ks, I've worked at NIH for almost 13 years, and I can tell you that I've probably listened to, I don't know, hundreds of K reviews, and I've only once heard that a K wasn't proposing to do quite enough research. But I've heard, countless times that what a K applicant was proposing was too ambitious. So even though if you're applying for a 4 or 5 year K, that shouldn't be the same as applying for a 4 or 5 year research grant. Because in a K, what you're doing is you should be having protected time for your own career development, for training, for time with your mentors, and you shouldn't be spending all of your time on your research. So I know it is something that a lot of people struggle with, but it's good to scale it back. And that's, I think, as a program officer, that's something that I often tell folks who are interested in applying for Ks. Another one that I highlighted here is that the career plan doesn't match the research plan. So if you're telling the reviewers, or you're in your application, you sort of state that you have all this amazing experience doing, structural equation modeling, and but you really don't have any experience in intervention development, but then you go on to say that you're going to do structural equation modeling from a large data set that you have access to for your AIM-1, that really isn't addressing a gap in your areas of expertise. So you really need to be proposing to do research that's addressing a training gap. So for example, it might be that you would be developing an intervention if that's what you wanted more experience in. The next few slides, I'm not going to really read through, but I just wanted to make sure that you had these available to you. So these are some grant writing resources available at NIH. This is I added this in, and I probably didn't like the position of where it was, but it was in response to someone's question that was submitted prior to the webinar. And I wanted just to make sure everyone knew about some resources that existed at the Center for Scientific Review. So as I mentioned before, when applications come in, they all go to the Center for Scientific Review. A small percentage go to the institutes for review, but the majority of applications are reviewed at CSR. And CSR has a number of videos on their website that sort of explain the process of a peer review, which I think is really helpful to understand. And they also have an early career reviewer program. So you can, if you Google early career reviewer program CSR, you'll come to their website and you can see if you're eligible, and you can apply. You can apply to be a part of that program. And just here's some additional resources. I just highlight NIMH and Fogarty's e-newsletters, but a number of other institutes also have newsletters. This is a great way to find out about funding opportunity announcements that are being released. These are two search tools that NIH has made available. So Reporter or Report is a way that you can search for currently or funded research. I forget how far back it goes. I think it goes back relatively far. And then the World Report website has some has information about funding from a number of different organizations in the rest of the world. My last slide is just going to end with my takeaway points. So looking forward to hearing your questions.
So thank you, Dr. Parker, and thank you, Dr. Allison, for your two presentations. I ask that those individuals participating on the webinar use the comment box on the side to pose questions to our distinguished speakers. And while we're waiting for additional questions to be posted, I just wanted to share with the group that the session has been taped, and we will be making that available to all of you as well as the general public to access, as well as sharing the slide sets that were shared with both by Dr. Parker and Dr. Allison.
JP, this is Karen. I just would like to bring up something that I did not mention. So I did talk a little bit about diversity supplements, but one thing that I think a lot of people don't know about is the NIH loan repayment program. And one of the loan repayment programs is for people who are conducting health disparities research. And with the new designation of SGM populations as a health disparity population, if you're doing research in sexual and gender minority health disparities, you can be eligible for the loan repayment program. And the thing that a lot of people don't know about that program is that you don't actually have to be funded by NIH in order to be eligible. So if you're getting funded through another, through Robert Wood Johnson or through another group, another federal agency, you can still apply for that, and it's a pretty generous program in terms of helping people pay back loans that they may owe from school debt.
So I'm just seeing that there is a question here. I don't know, Karen and JP, can you see that question from Christina? Maybe that's a question. I don't know, Karen, if that's.
I can't see it.
Okay. If you click on the chat, but I'll read it for you. Is there a way for SGM applicants to indicate their status in the same way that racial minority candidates would be able to do so? This seems important given that the nature of the research is to fund SGM-related research, and it would be counterintuitive if SGM researchers themselves were not prioritized in this process. You sort of touched on this already.
Yeah, so that's a little bit of what I was saying related to the data and the lack of data in terms of sexual and gender minority identified researchers. And so we are thinking about ways that we might be able to capture that data of all of our applicants so that we can then demonstrate that sexual and gender minority populations are an underrepresented population within biomedical research and that we should be considering identity for some of our programs, but we just don't have that data yet. And so at this point, there is sort of no mechanism to do that unless you include that information in a research project. But I just don't know if, what the outcome of that would be. There are no special programs for that.
So a couple of the other questions now, so there's one from, well, I'll just read it. There have been few projects that solely address transgender health. What are some projects that the SGM RO is interested in?
So I'll just say that the Sexual and Gender Minority Research Office does not actually have grant-making authority, so we do not hold our own research portfolio except for our administrative supplement program, which is consists of small supplements that we give to already funded projects. So the funding happens within the 27 institutes and centers across the agency, and so several of those are signed on to both the Sexual and Gender Minority Health Program announcement and to the Transgender and Gender Nonconforming program announcement. And so those have both been put out, and they are a way for NIH to demonstrate that we are interested in these specific areas of research. The other thing to keep in mind is that a vast majority of the research at NIH is actually funded through program announcements that are called parent announcements. And so there are ways that you can submit a grant to what is just called investigator-initiated announcements. And so if you're interested in a specific topic area and NIH doesn't have a funding opportunity announcement specific to that, it doesn't mean that you can't apply for a grant. It means that you could definitely work with a program officer to hopefully find a parent announcement that your work would fit under. And so we have been funding projects. We've been getting a lot more projects in transgender health, and we are seeing that the sexual and gender minority portfolio in general is definitely increasing. And, you know, I think that we'll see with the FY17 data that just became available, we are seeing a trend over the past 3 years at least, where we are funding more and more research.
Great. All right, another question. How many grants have been funded under the SGM PA? Will there be a push for an SGM-specific study section?
So several projects have been funded under that SGM program announcement, but the majority of what we fund actually comes in through other program announcements or through investigator-initiated awards. But those program announcements have really helped to spur interest in the area. I will say, too, that when you look at a program announcement, it's really important, I think Susanna mentioned this, to see what institutes and centers are signed on to that program announcement. So not all institutes and centers are signed on to our program announcements. That doesn't mean that they aren't interested in getting applications, and it doesn't mean that they aren't funding research within this area. And then the follow-up question about an SGM study section. So we have talked about that some, and due to the way that study section and review happens, there is a concern that if there were an SGM-specific study section, that less research might get funded. And so we really want to make sure that there is SGM research across a variety of health diseases and conditions. And so we really don't want to necessarily be siloed into one specific study section. If someone puts out a program announcement, or I guess an RFA where there's money set aside, then oftentimes there is a special study section. But I'm not sure that that's the best way to move forward if what we really want to do is increase SGM research across the board.
Great.
Hey, so I know there was this question around, can't we just ask about LGBTQ data and collecting data? Can you just remind the group where they can access the document, Karen, that you mentioned about measurement and sampling?
Well, so that the document's not actually been developed yet. There are 3 papers out from the Federal Interagency Working Group on measuring sexual orientation and gender identity in federal surveys. And so those papers were released and were online. I've shared them to the listserv. Those are really important to think about kind of what's currently happening and what the next steps are. But our measurement document will not actually be ready for a while. And then I think there was also a follow-up question about can't we just ask about LGBTQ? I mean, in many ways, that's how I look at it. Like, why aren't we just asking the questions of all of our applicants? But the discussions at NIH have led me to believe that it's a little more complicated than that. And that's not, the questions that we ask on applications are not things that NIH can't just make those decisions on our own. There is a process. And so there's also a very large cost to adding questions of any kind when going out and asking applicants about that work. So it's something we're working on. It's something we're talking about, but it's not something that's going to happen tomorrow.
I just want to add something to that last piece about assessing sexual orientation and gender identity amongst researchers or applicants. So recently, I guess not necessarily recently, but over the past couple of years, the Association of American Medical Colleges has included those two questions, like how do you identify in terms of sexual orientation and gender identity, on their national standardized surveys to assess those two forms of identity amongst medical students along the pipeline. And it's also currently being now collected amongst faculty. So I think that's promising in changing the culture of collecting that data amongst our research workforce. And I just share that. And they've put out, the AAMC has put that data out in a number of reports in case anyone is interested.
So let's see, I'm just looking at some of the other questions here. So for dissertation funding, do you recommend an NRSA, R03, or another funding mechanism? There are actually, there are a couple of different funding mechanisms for folks who are working on their dissertation. I probably wouldn't recommend an R03. I would recommend like an F31, and there's also R36s, I believe, if you qualify. Those are to support doctoral students from diverse backgrounds. But again, I would encourage you to spend some time on the NIH training website, and then to look at the program announcements and reach out to folks who are listed on those program announcements to ask them. And if it's a, SGM related question, feel free to reach out to myself or Karen, and we can put you in touch with the right person to talk further about what mechanism might be the best for your dissertation work. So there was also just a note to mention that DSD research also falls under the SGM umbrella at NIH, so thank you for making that note. All right, there's a couple comments that I can let everyone read kind of around. They're not really questions, they're more just comments. So feel free to review the chat if you're interested. And yes, there's a current T32, I believe it's at the University of Pittsburgh, and I think Ron Stahl is the PI for that T32, but I'll double check that. Again, yes.
That's correct, Susanna.
Yeah,
that's correct. It's at Pitt.
Okay, perfect. And you can find out more by searching for that on NIH Reporter. And if you're having any problems, again, feel free to reach out to myself or Karen, and we can help you to navigate that system.
There was also some questions about the SGM program announcements, and I'm hopeful, but that information about program announcements is not public yet, and so if and when those get republished, we will certainly be sending that information out through our listserv. If a program announcement does not get reissued, it doesn't necessarily mean that NIH is not interested in this work. And I think if you look at our portfolio, for example, through NIH report, you will see that we're funding a lot more research. And so much of that is because we're getting a lot more applications than we have in the past, because people are kind of understanding that there are so many unanswered research questions, that people at NIH are more aware of these issues and understand better this need. And so I don't think that there's been any indication that NIH's interest in this work is decreasing.
And then maybe we'll just do one more question. Does that sound good, JP?
Yeah.
There was a question posted around training for reviewers on SGM research, and so I don't know. Do you want to comment on that, Karen?
Sure. So that was one of the things that I talked about for what we've been trying to do is to think about what type of information would be most useful and how we can work with CSR to get that information. And so that's what the points to consider an SGM research resource would really be. It would, you know, thinking about sort of who's the audience for that and how can we educate people. So that is also on our radar screen, and we are in talks with CSR about how we can educate folks there.
Excellent. Well, I just want to take another moment to thank Dr. Parker and Dr. Allison for participating in this webinar today on overview of sexual and gender minority related activities and training opportunities at NIH. Thank you. We will take the questions and comments posted on the side, and along with the slides, as well as the taping of this video, make it accessible to everyone who registered. If you're interested in learning more about BNGAP, please go to the website of BNGAP at www.bngap.org. Consider joining us for our next annual LGBT Health Workforce Conference on May 3rd to the 4th, 2019. And lastly, the next BNGAP webinar will be held on June 21st, and it will be dedicated to opportunities to publish educational scholarship in academic medicine, a MedEd portal with a particular focus on trainees. Thank you again, everyone, and have a great evening.